students. Just out of interest, has anybody been on my FSCJ this weekend? Have you noticed the differences?
Did they change the user interface?
Yeah, they changed their interface, so it might take a little while getting used to it. The other thing I have to mention to you guys is that this afternoon, or it's at 11:30, so I guess it goes into the afternoon, there'll be 3 other students here. There'll be AA students, Associate of Arts students, who are doing the subjects of student life. So I'm gonna have to generalize this program. Now, normally we would do things like interviews, we'll still do interviews and how to deal with difficult people and stuff like that. But whereas normally I would hone in on the radiation therapy part of that, it will be slightly more general, okay? I don't know what these, I think they're all ladies, I don't know what these ladies are doing, what type of program they're doing and what they're aiming to do afterwards, so I'll have to catch them in class and see what they'll do, okay? But today, I'm going to give you, I've been talking about these things forever. These are the film badges, which you will wear in clinic. And I'll show you how to put them on. So these are the things that you do not put onto your, do not keep on your scrubs when you go out of the building. They stay in the department or they come home with you in a handbag or wallet or pocket or something. They do not get exposed to the sun, okay? Especially here in Florida. So, this is the, everybody see this? Oops. Can everybody see this? This is a long clip, okay? And this clips onto something like that. You wear it around your collar. Wear your ID badge, which I don't see anybody wearing today, ladies and gentlemen. I'm lying this morning. Yeah. So basically what a lot of people do is, excuse me, now, is just put it on your film badge, on your thing like that. But please don't do that so you can't see the face, okay? So I'm going to get each of you though one of those.
Stop talking about clinics. I'm gonna show myself. I'm really nervous.
Why?
I don't know. Every time you say clinic, my stomach does like a circle.
What specifically?
Everything.
We're going to talk about this morning, so just
So last night I was sitting in bed and I was like, I'm so nervous. And my husband was like, why? And I was like, every Sunday I get really nervous.
Anybody not have one?
And he was like, you have the same professor your whole course. Like, I'm like, okay, I still feel like I'm gonna puke. Like every morning, every Monday morning, I'm gonna puke before I go to class. And he's like, relax, calm down. And I was like, and Tuesday's gonna be even worse.
How to make me feel good before she comes to class. Okay, now puke before you come to clinic. That's another thing.
This isn't the back, that's just the clip. That's just the clip. I was gonna say, where's
So
the?
here are the, let me just, okay.
But I have to drive really far. So my
Oh, come
stomach.
on, you're in South.
No, I'm talking like to here.
Or to here.
But like my stomach turns the
So-
whole car right here.
So I know that some people won't be starting clinic for a couple of weeks.
Oh no.
And that's just partly because now I'm gonna go over some stuff, so bear with me here for everybody's entertainment here. So Morgan, you will be going to Orange Park, you know that. However, I got an email from your friend Kathy saying that she can't start you until the paperwork is through and acknowledged. So it's probably going to be a couple of days.
Okay.
So don't go until you either hear from me or hear from her.
Okay.
Okay?
What paperwork?
Same.
Why couldn't you say that?
What paperwork?
Basically, it's not our paperwork, it's the Genesis Care paperwork. This is the first time they've had students since the beginning of the pandemic. So they have to get all the ducks in a row.
Okay.
So it's nothing to do with us, it's just the Genesis Care itself.
But you'll let me know when I'm supposed to.
Yeah, either you'll get a phone call or an email from me, or
Okay.
you might get an email from Kathy.
Okay.
And if you get an email from Kathy, please let me know as well.
Okay.
She'll probably email me, but just in case. Okay, so, Christina, where are you? There you are. I was looking at my clinical exchange. There's still a few things that you have to do
I submitted it.
in there.
Yeah, last night it's pending.
Oh, okay, it may have not. So you've got all your,
It was the
Car.
confidential. Yeah.
stuff all done?
Uh-huh.
Okay,
That was just the registration updating it because my birthday
right.
last week, the first time I did it.
So you've got your make of the car and all that lovely stuff in?
Yes,
Okay, so that's fine. And you found the confidentiality agreement?
Yes, ma'am, I emailed support and they gave me one that
One.
typically they use at Baptist, so I
Okay,
signed
that's
it,
fine.
uploaded that.
So that's good. Okay, so that's solved. Okay. Megan and Stephen, any questions about University of Florida? Proton Center?
He emailed us and gave us 2 forms to do, or 2 things to do and print out had on Tuesday, but I think we both got it.
Right, okay, so you've got them, mailed them back.
We bring them in
Oh,
Tuesday.
you bring them in, okay, that's fine, okay. And I didn't mention where to park, did you get that?
Yes,
Yes, ma'am.
And you got the code, wonderful, okay. Mallory and Molly to Gainesville. I believe that I saw that Philip had emailed you guys.
Yes.
Everything okay? Good, okay. And Asia,
Yes.
please don't comment on the video.
I'm looking for my emails because I'm worried now that I didn't get a freaking email.
No, that's okay, that's okay, don't worry about it. He's expecting you tomorrow, so no problem.
Oh my god.
I did tell you, you met him.
Yes.
Everything goes
That doesn't
smoothly,
matter.
by the way, on that.
Yeah.
It doesn't matter.
You're the one that shouldn't be vomiting
I
here.
am, yeah,
So how did you find the actual clinical site? I mean, not the clinical site, but the machines and stuff.
That was really cool.
Nice.
Super cool.
Nice.
Theirs is
That's a big door.
Yeah, yeah. So basically that's the same as you will find in any clinic. The machine might be slightly different, the way it's made might be slightly different, but that's it. They all know, all of the clinics know that you have never been in clinic before.
That's really
So, they know that. And I've reminded the point people to tell their staff that, okay? So, Carly. Carly. Yeah, sorry. Sanford, they have to wait for you to have your other
Next one's
Next. 19th, right? So rather than the 19th is a Thursday?
It's a Wednesday.
Wednesday. So rather than sending you all the way down for Thursday, you'll be starting on the following Tuesday, okay? And the other 2 ladies, Brianna and Stephanie, South Georgia are taking people. So I'm just waiting on clarification to see what information they need. I have paperwork from them for you guys to fill in. I will send that to you this afternoon. Fill it in. As I say, I'm still waiting for we're a go, because I can't send you without that. But once the paperwork is all filled in, so it'll probably be a couple of days
So do
before
you,
you get started.
so do you think we'll start this week or?
I would imagine next week.
Okay.
Next week. So it's not gonna be that long.
Okay.
What school, or not school, what hospital?
Well, there's one in,
I was just gonna ask.
there's one in St. Mary's, and there's one in Brunswick. So I'll make the choice when I get the firm, yes, we can do this. Because what I've had to go do is go through, and this is what happens with most places, I have to go through the educational director. And she says good, and then it goes to the chief therapists, and they say good, and then you can get sent. It's politics. But anyway, let's see these.
So do you think it'll probably be next week for me too, most likely?
Well, she was saying it would probably come through on Tuesday,
Okay,
but I don't know.
okay.
I would imagine it would be Tuesday, but it depends on when they actually give
What
her,
you mean like tomorrow, Tuesday?
like tomorrow, Tuesday. But obviously, if it comes through in the afternoon or late morning,
Right.
it's not worth going in. So, sometime this week, I would say.
So if we start later, does that mean we can send you a week after?
We can do that, we can keep you in that department for the next semester. But the first, why I'm not too worried about it is that for the first week or two, you'll only be observing anyway, so it won't cut down on the amount of clinical work that you actually are doing, okay? So here are your, okay. Oh my goodness. Mallory. Carly. Oh, sorry. I'm sorry, Carly. Trying to excuse me, aren't you? Very good. Thank you. Leave it and I'll show you where to go. Stephen. Okay. Morgan. Brianna, there we go. Fine. Christina. Asia. Thank you. Molly, you. And Stephanie. So, let me show you how to do this. You've done it. Okay. Oh, I don't have one. Everybody got it done? You should.
It snaps in, right?
It just snaps in. So this is the top, okay? Make sure you've got it this way. So it just goes in
Oh no.
this side, the bottom side first, like that, and then it just clips in place, like that. Everybody got it? Everybody not upside down? Okay, so from now on, that's something you hang on to. Do not lose it. And make sure that it goes to the clinic with you. Because they may not let you work if you don't have it on. Okay? Garbage. Okay, the other thing is I am going to give you, I procured, that's sleazy, doesn't it? I procured some masks, some of these. So I'm gonna give you half a dozen each, okay? So you can wear them. They will have them at the clinic, but just in case, okay? So I'll give you half a dozen each, so that if they don't have them or you can't find one, then you can put in your little stash. And I'll put them in a little baggie for you, a little Ziploc, okay? So, that took shorter than I wanted. So, the first week is called Professional Development Opportunities. So, you'll be doing, once you finish the program, everybody intends to work at this program, right? Or this field for at least a little while. I'm looking at Asia.
I know. Emails. Of course.
Yeah, so everybody's, oh, the other thing is, remember guys, do not go into clinic with your hair down. Okay? Make sure it's either back or up, whichever. Everything has to be up. Make sure that you don't wear long earrings. Molly, got your earrings on. Make sure that you don't wear earrings. Make sure they're little studs or maybe a little loop. Nothing too dangly. Same with bracelets, chains, rings, anything that can catch on a patient. Okay. Some departments are more strict than others. Some departments will insist that if you have a wedding band and an engagement ring on, you only wear your wedding band. Okay? If you wear a ring on your other hand, make sure it's flat, or as flat as it can be, signet ring, something like that. Okay? But depends on the client. I'm just doing the worst case scenario. Okay? But certainly hair tie back. I don't care what the therapists are doing in the department, they're no problem with me. You're my problem. Okay? Well, you're not a problem, but you know what?
Yes.
Make sure that you do not. First of all, it's unprofessional. Second of all, you wouldn't like someone leaning over you and your hair dangling in their head. So, professional development opportunities. Once you're finished with your program and you pass your registry, which of course you all will, all things being equal and luck being out on our side. What do you know that you have to do for, well, first of all, to keep your registration?
Hey. I mean, take classes.
Pardon?
CEUs, continuous education units.
CEUs? How many?
12 a year or 24 over 2 years.
That's right. The other thing is that you also have if you work in Florida, and it's the same for most of the rest of the states too, you will also have to have a license. The license in Florida states that you will have to have 12 CEUs per year to keep your license. And then 24 for your registry. So basically it's the same. You do 12 a year for your license, which gives you the 24 for your registry. What happens if you don't? Yes, you do. you will, first of all, you get put on what they call probation. And then if you don't do it in a certain amount of time, you will have to do your registry all over again, and you really don't want to do that. Okay, so it's easy. The best way to do it is to be a member of the ASRT. Now the ARRT is the registry, right?
Yeah.
What does the ASRT do? Anybody?
The membership that offers resources and stuff.
Yeah. What else does it do?
Email you when it's time.
Sorry?
Email you when it's time to take your courses.
Yeah. It actually gives you continuing ed credits. Remember the thing that I gave you for the Hodgkin's disease? That is what they call directed reading. You read a paper, you take a test. That will give you anything from 1 to 3 credits. So you get 2 magazines every. The Radiologic Technology magazine you get every quarter. And the Radiation Therapist magazine you get twice a year. Each of these magazines gives you directed readings. So you read the paper, you take a test, you send it in. And they give you a way of doing that online. So you can collect your credits that way. It's a much easier way to do it than trying to look around for continuing ed credits. The other thing about the ASRT is that all the credits you get at the ASRT automatically goes to the ARRT. So they send it to them. Whereas if you do it outside of the ASRT, it will still be counted, but you physically have to send the certificate or whatever you get for your credits to the ARRT yourself. So it's a lot easier to do it with the ASRT. That makes sense? Okay. So what else is there? What else can you do once you graduate?
Apply for jobs.
Apply for a job, okay. We'll cover that this afternoon. Okay, apply for a job. I'm talking about professional development.
Okay.
So each department usually has some kind of, we used to call them in-services. They bring people in to bring you up to date with whatever breast cancer treatment or lung cancer treatment or something like that. There are these seminars that go on. You can go to them. Normally, you can ask for time off and they may even pay you to go to the clinic, whatever clinic you have to work in. They may even pay you to go. What else? What else is there? We're talking about conferences. There's a radiation therapy, there's an ASRT radiation therapy conference once a year, annual radiation therapy conference. It was held virtually last year. They're saying that it probably will be held in person this year, but nothing has actually been decided yet. And if it is in person, it will be in Chicago. Obviously, you'll still be students at that point, but they have a reasonable rate for students. If you want to go to it. I'm not sure whether I'll be allowed to go to it again, so that's. What else is there? What else can you do to, enhance your skills?
Go to school?
Or do something else?
Go to school?
Pardon?
Go to school?
Go to school for what?
Like get a bachelor's?
Yeah, what might that give you?
A bachelor's?
Yeah, but what? Okay, yeah, a bachelor's. But how would that enhance your standing in the center?
Would be
You'll have more knowledge.
So what would you do a bachelor's on?
I don't know.
Bachelor's
management.
in? Pardon?
Management.
I can't hear you.
Management.
Management. What kind of management? Healthcare management or just an MBA or a bachelor's of administration? It's actually better to do bachelor's of healthcare administration, then you can go on to do a master's of healthcare administration. They're looking more for that than an MBA or a bachelor's in administration, just pure administration. The bachelor's in administration is
Broad.
more in business. Now, I know that healthcare is a business, but it's better to do a bachelor's in healthcare administration, and then if you want to go into master's. So, would a bachelor's in healthcare administration make you a better therapist?
No.
Maybe on paper, but not necessarily in
No.
real life.
It wouldn't, because the healthcare administration is general. Would a bachelor's in radiologic technology or radiation therapy make you a better therapist?
Yes.
Why?
Because it's specific.
What kind of education though? What kind of education would it give you?
Therapy?
No, it doesn't. The difference
Machine?
between an associate degree in radiation therapy and a bachelor's degree in radiation therapy is it goes along the line of psychology and patient management and stuff like that. So it wouldn't necessarily make you a better therapist. It would give you more, it would make you look on paper like a better therapist because you have a bachelor's. Wow, bachelor's is a heck of a lot more than an associate, right? But it doesn't necessarily make you a better therapist.
Do you get paid more?
No, not necessarily.
So what's the point?
Exactly.
There you go. Why did you say that?
I don't know. I got 10 months of my GI Bill left. I've got
I've seen
I've got to use it on
the
something.
job ads that say they prefer bachelor's.
Yeah.
They don't
Yeah.
accept associates, so.
Yeah, so there's not necessarily a wage gap between bachelors and associates.
But if I'm going and I'm like, I have a bachelor's, so I want to be paid more.
Bye-bye.
All right, see you later.
They don't, we'll go over that when we do your resume
Okay.
and your interview skills.
Okay.
You don't want to do that.
Okay.
The last thing you want to do in an interview is discuss money. That comes later, much later. They won't even have, see, that's dealt with by human resources. That's not dealt with at the first interview.
I haven't been in
Because
an
the first
interview in like
interview
6 years.
is purely technical. There's a therapist, chief therapist usually, and floor therapist, maybe a physician. They have no idea what money's all about. They don't want to know. The human resources work with that. So that's not necessarily a good thing, to jump on the money. Money is not, and I know it sounds weird, money is not everything, guys. Seriously, money is not everything. So what else could you do in order to enhance your skills?
Specialized
In what?
keys or certain behavior types or certain treatment types?
There is, in most departments, you're a therapist and you're a therapist and you're a therapist. There's no, unless you're at a pediatric hospital or you're at a veterinary hospital, believe it or not, they do radiation therapy for pets. That would not be, and there is no clinical guidelines for what to specialize in. You can't go and say, I want to specialize in pediatric oncology. There is no course for that. There's no course for veterinary oncology as far as radiation therapy goes. It's purely experience.
So when we're done with the program, we could, in theory, apply to veterinarians?
Yeah. Yeah. You can. They may do a little bit of in-service
Yeah. they were-
information, but there is no separate program for veterinary oncology. Even the vets don't specialize in it. There is no program for vets even to specialize in that. What else? What else is a specialty or a subspecialty in radiation therapy? There are some large departments that they have an internal course for brachytherapy therapists. But that's really a big, big center. And there's no one in the city except maybe the Mayo that would do that are big enough to do that. Now, MD Anderson in Houston, I believe, has one, but not here. What else is there? You've heard of the cemetery? No. Anybody interested in the cemetery?
Math,
Pardon?
a whole lot more math.
A lot more math, a lot more physics. Yes, ma'am.
I'm interested in it. What do I need to do?
What do you need to do?
Talk to your
You need to find
dosimetrist.
the cemetery school.
That's right. I look for them. There are not many of them.
There are not many of them, no. It used to be that you could, as a therapist, do on-the-job training. However, that has now been kiboshed. The cemetery people, the people who run the cemetery programs, say that no, it has to be done through a school. There are several in the country, but not many.
No, there's not many.
And I think,
And I couldn't find one of them that did virtual.
no, there's none that is virtual. At the moment, there's none that does virtual.
So you'd have to like move somewhere to do,
Yeah.
oh my goodness.
That's it.
And I didn't see one that was really, flexible as far as really they want you to go through their whole bachelor's degree
Yeah.
with them. So it's like,
And most of them will.
Yeah.
Now, I met with a lady who had the symmetry program. Let me look it up for you. The one I know is in California, it's in Loma, but that's.
I thought there was one in Georgia for some reason, and I might be wrong.
I think there
It's
is.
a bachelor's in radiation therapy.
Yeah, if you could
I'll
run
look
across
it up. I'll
ones
see if
that,
I can look it up, yeah. I'll see
appreciate
if I
it.
can look it up, yeah. Yeah, that's one thing, that's one reason. That is a subspecialty. They would expect you to, of course, to have a certain amount of experience in radiation therapy first. They suggest 2 years.
I did see that.
Now, tell me why. Why do they insist that you have 2 years in radiation therapy before you go into the cemetery?
First year, you're typically learning.
So, say again?
Isn't like your first year, you're typically learning, like going through the motions?
By the time you graduate, you should know the motions,
Yeah.
but they need experience. They need you to have at least 2 years' experience. So why would they insist on that?
Knowledge.
Knowledge? What kind of
Well, and
knowledge?
you know that's what you want to do too. You're not,
That's true. What else? They want the knowledge. What kind of knowledge do they want, do you think?
not practical knowledge you gain by dealing with patients and
Yeah,
seeing.
so basically what they want is someone who knows what the machines can do. And more importantly, what the machines can't do. Because if the dosimetrist produces a plan and it's absolutely beautiful, but the machine can't physically get to that angle, or the bed can't get to that angle without bashing into the machine, then it's a hopeless plan. It's a beautiful plan, but it can't be done. So they want somebody with that kind of know-how.
So nobody just graduates high school and is like, I want to be a dosimetrist without
No.
going through this?
The majority of the departments, or the majority of the schools will insist on a radiation therapy background. Now, there are some programs that will accept a bachelor's in science, but then they'll put them through a lot of different programs in order to make sure that they have the basic knowledge. And I've worked with a couple of dosimetrists that have come through one of those programs. And it took them at least a year in the department to figure out what we do, which is basically a wasted year because they plan these plans but can't be done. So that's why they insist on radiation therapy background. So what about physics? What about being a medical physicist?
No.
No? So what does a medical physicist do in the department? Anybody? What does medical physicists do?
Feel like we do a lot of testing.
Sometimes.
Less patient interaction.
So does the cemetery. They don't have patient interaction. Well, very little. So what kind of work does the physicist do on the machines?
Quality assurance.
Quality assurance. And what does that mean?
Make sure it's running.
You had to say it, didn't you?
Checking measurements and making
Yeah.
sure you're getting the results that you expect to get.
Yeah.
before
They-
patients come in.
Yeah, they make sure that what you think you're getting is what you're actually getting. They are basically
not
in
leaving
charge
that.
of how the machine works, and if something goes wrong, they are in charge. They may ask you what went wrong, what did you see, what did you feel, what did you see, etc., etc., etc. What did you hear? Then it's their job to look at it, and it's their job to, if necessary, call the engineers, the manufacturer's engineers. What about being a rep, a representative for the machine manufacturers?
No.
What would they do you think?
Go door to door selling.
Travel around a lot.
I hate that.
No, they don't actually, no, this is, the reps are, people who come and teach the staff how to use the new equipment.
They bring food.
Pardon?
They bring food.
And bring food sometimes, yeah.
Better.
Pardon?
And hens, lots and lots.
Well, no, they've cut down on that because of HIPAA.
Hens?
They cut down a lot on that, yeah,
How is that HIPAA? Give out hens?
yeah. Pens, pins, donuts, lunches.
See, that's what I heard, and when we were down there at Flagler, he was telling us to be prepared to get fat because they're still constantly bringing food and stuff like that.
Yeah, the patients do.
No, he said the reps were
Yeah,
still doing it.
But it was a lot worse before HIPAA, or a lot better, whatever way you want to look at it. But, yeah, so they would come in, if you got a new machine, for example, or new software, what they call the application specialists, who are therapists, would come in and show everybody how to use it. How to use the hardware, which is the machine, the software, which is what runs machines. I did that for a while. Loved the work, hated to travel. Actually, I like to travel, I just didn't like airports. Pardon?
Airports, so.
Yeah. So nobody wants to do physics.
Oh, no. Let's try to get through this first. Who knows?
You have to start thinking, you know? So, okay, let's go back to the basics. You're a therapist in the department. What would help you get better as a therapist? What do you think would help you get better? Would things like people coming in and teaching you how to, what the next best thing is, the next big thing in radiation therapy, would that help you be a better therapist?
I think just like talking with patients and like empathizing with them and like getting to know them would make you a better therapist.
So you're working in a team. You're the junior, you're the plebe, call it what you will. You're working with two therapists, one who's got 2 years of experience and one that's got 15 years experience. Who would you listen to when they were telling you what to do or suggesting what would be better?
I feel like that would be situational, because the younger person would know about the newer.
Not necessarily, because the 15-year veteran has been doing all these in services and has gone to all the, so it's really difficult to figure that one out. Listen to everybody.
Yeah, they both got more experience than you.
Yeah, exactly, they've both got more experience than you, yeah. The other thing that you don't want to do is rock the boat, especially when you're a new therapist or a student. Never rock the boat. If you see something that you think is wrong, what would you do?
Out of curiosity.
Ask who?
The lead therapist.
Is she on the machine? Or she or he, excuse me.
If they are, I mean,
Are the lead therapists on the machine?
not all
So you would ask whoever is currently on.
Well,
the time. The immediate
it,
supervisor.
well, that depends. If you see one of the therapists doing something that you think is wrong, how would you go about asking, why did you do it that way?
Ask them to explain.
Class, we were told that it's this way.
Ask them to explain why.
When would you do that though?
Not in front of
Not in front of the patient, no. Definitely not in front of the patient. If there's two therapists in a room and yourself, and they both do something that you think is not advisable, I won't say wrong, but not advisable. You would go out, you would wait for a break in the chaos, and you would ask, I noticed you did this in class, we were told that this is what you should be doing. Can you clarify that for me? You have to do a non-judgmental thing. Well, this is wrong. Does that make sense? You ask politely. You ask in a way that won't put the backs up. Makes sense? So, we're back to professional development. So, there are some people that graduate, get their first job, and say, okay, I'm set, I don't want to do anything ever again. I don't want to go to school ever again. I want to just keep plodding on in my job, and I get better as I get on. Is that something that is good? They go to all the services that the clinic puts on. They may go to a conference once in 3 or 4 years, depending on when their turn comes up. But they don't go back to school or get further education or whatever. Is that a good thing?
Sure. I don't think it matters.
I don't see a problem.
No, there's no problem with that. A lot of the therapists are like that. They'll do the in-services, they'll go to the in-services that the department puts on. They'll say, can I go to ASTRO, which is the National Radiation Therapy Conference next year? Sure, we'll put you in line. There's maybe 10 people. You may get to go every 5 years, which is fine. It's a big center, so you may only get to go every 5 years. Unfortunately, sometimes it's based on seniority, so the senior therapists always get to go. But in some departments, yeah, they'll send the juniors. The only problem is, if you go, you have to do a presentation when you get back. So you don't go and not go to the lectures, because everybody knows what's on there, because everybody's seen the presentations. So they know what you should be going to. And if you go back and say, well, I didn't go to any of them, yeah, you'll never get to go again. Because they usually pay for it. And if they pay for it, they expect something in return. Make sense? Okay, so you do all the in-service and everything, but you don't ever go back to school. What about if you actually land in a department with students? Sometimes in the larger centers, they have what's called a clinical instructor. So you're a therapist that works on the machines, but also teaches the students. In most departments, it's just the normal therapists that teach the students. In bigger departments, sometimes there's a special person who will work with the students and make sure that they're getting the correct information and what have you. And we thought of doing that.
I would like that.
Nope.
I don't know with anything that's like people to people. Desk stuff and numbers and computers, minimal, but I'm more of an interactive face-to-face. So teaching
Well, remember, a lot of our work is now on computer.
Well, yeah, I mean, I'm not computer illiterate, it's just not my favorite thing. It's just, I prefer to be on the floor.
Yeah, yeah, and that's fine, that's fine. So there are certain people that like to do that, other people don't. Or work, students probably teach them too much, you know. But part of your job is teaching. There's another one that in some of the big departments, and I've done all of these by the way, just so you know, is they have an instructor or a trainer that trains the staff in new techniques. So if somebody was starting a stereotactic radiosurgery program, then the therapist would have to be taught how to do this. That's where the staff instructor comes in. And they would bring all the staff in 2 or 3 at a time and teach them this technique. That's also a good thing. And that's purely, you don't need any, theoretically, you don't need any other schooling for that. It's purely experience. But then, of course, you can go back to do bachelor's, master's, if you so desire. And either do it in radiation therapy or radiologic technology or radiation sciences, whatever they want to call it these days. Or you can do the admin thing. You have to decide what you want to do. Do you want to stay on the floor and treat the patients and have students if necessary? Or do you want to go in and teach? Or do you want to go into administration, management? Who here wants to do management? No?
I don't want to, but I'm open to it.
Yeah. The symmetry.
I like self-improvement, but I want to.
I don't know, I feel like once I did 5 people in a clinical, I might decide I like something, but I don't know I like it.
Yeah, exactly, exactly. I worked
I'm open.
in clinic for, in one way or another, for 30 years. One way or another. On the floor therapist, clinical instructor, staff instructor, lead therapist, chief therapist, manager, and now he. So I've done it all. The only thing I haven't done is the symmetry. because I had no inkling to do dosimetry. I actually was told something at one point. There was a dosimetry opening in the department that I worked in Canada. And one of the physicians came to me and said, why aren't you applying for the dosimetry position? And I said, because I don't want it. He looked at me and said, why not? I said, because, well, why not apply anyway? I said, I don't apply for positions I don't want. Oh. So I applied for it, and I said, no. Because if I get it, I have to refuse it because I don't want it. And then it looks bad. Oh, yeah, okay. What do you do? Any other comments?
So once you're registered, you just do CEUs forever, or is there a certain period of time where you have to sit for another board exam?
You don't have to sit for another board exam. However, there's now what is called a continuing something that you have to do after 10 years. So it's basically a review of what you've done. It's not an exam. It's a refresher of what you've done. And it can be done over a period of 6 months or so, I think. And that started 2011, I think it started. So anybody who graduates after a certain period of time has to do this QI thing after 10 years, I think. Let me just see if I can get it on the board here. Okay. Where's Firefox? Okay. Oh, of course. You didn't see this. Because I don't want anybody to email me at my home address. Oh, no.
Sure will.
Not you, go away, not you. That's what. I've done that, you silly
Why does the
person.
army keep emailing me?
Is it in the school, like the
Yeah.
I will just send them like sometimes I'll send them a picture of my uniform.
Should I send a picture of me in uniform?
Yeah. Or like I emailed Kyle and he sent off a paragraph about like how he doesn't like crayons. And
Oh my god.
Oh, come on.
yeah, it's great. He didn't get a response.
I'm sure.
I got a thank you for your service. He got nothing.
Okay, so let's see. So this is the continuing ed. So you have directed readings here. So these, let me just get, hang on, let me get, okay. So these are all of the directed readings for 2019, 2020, 2021. And if you look at these, so there's 1.75, 1.25, 1.5. So if you do all of these, You can easily get 24 credits without even thinking about it. And basically what you do is you read the quiz, you read the paper, you take the quiz, and do it electronically. You can actually,
I want to do that.
correctly,
You have to wait till you
you can actually take the quiz
Why
online.
not?
You can actually read it online also. QI, I think is what it's called. Let's see.
You can at least read it. Maybe not do the quiz.
Okay, so it's not that. Anyway, I'll find out about this later.
Wait, so you said 24?
Yeah.
Okay, I thought earlier you said 12.
12 a year.
12 for a license every year.
Oh,
So if you do it yearly, it's 12.
okay.
But normally, you have what is called a biennial. So your registration comes up every 2 years. You pay every year. But you have to get your CMEs every 2 years, the 24 CMEs. So you could do, if my biannual, and it ends on your birthday. So my birthday's in December. So I could leave my CMEs till October, November, and still get all my 24 credits.
So you could do the whole 24 at one time instead of doing 12. Is that what you're saying?
For your registration, not for your license. Your license, you have to have 12 each year.
Okay.
So because you have to have 12 each year for your license, it's just as well to do your 12 and 12. It makes it easier to remember.
Like if you did the 24 in 1 year, then you'd still have to do 12 the next year, right?
It depends on when your biannual is. So if your biannual is, say, 2022 on your birthday, and you do 24 this year, which is 2021, you don't have to do any in 2022. If you did 12 in 2022, you're wasting your time, because they don't carry over. But if your biennial is 2021, then you better make sure that you've done your 24.
Gotcha.
Okay. This is another thing that the SRT does. So there's your radiation therapy student exam library. Exam 1, this is for radiography, of course. So you have several student exams. I did exam 2 several months ago, so it's not giving me the option of doing exam 2, so exam 1 and exam 3. And of course, catalog. So let's see if there's anything in. Breast imaging essentials, MR basic. Proton therapy.
Are these exams?
No, the courses.
Oh, okay.
The courses, you see it says here, Proton Center, Proton Therapy 2-module set, 3 credits, CE credits, and a member price is $45. If you're a non-member, it'll cost a heck of a lot more than that.
positioning guide for 1,800 degrees.
That is radiography probably.
It was right above the 45.
Yeah, radiography. That kind of thing would probably be done by the school. So all of this stuff is there for you to use if you're a member. If you're not a member, obviously you can't do that. And you can see there's all sorts of things here.
And so these are for like just because if you wanna take
Yeah.
it.
Exactly. If you want to, there's one radiation protection, radiation therapy, $22. And it gives you 1.5 credits. Proton therapy, physics and equipment. Proton therapy module 2. Patient-centered care for diverse population. So all of these you can add to your CME credits if you're a member. If you're not a member, you can still get them, but at a price. Really low cost price. So there's. So this is all radiation therapy stuff that they've got.
That's not fun.
And lots more. But that's only if you're, as I say, only a member. You can do the radiotherapy exams, but I think they're for a non-member, student non-member, I think they're $10 each. So it's actually better if you join the student ASRT. Who's a member? Who's a student member? Oh, good. Okay. Have you started looking around them? You find them reasonable? Yeah.
But I don't know, if you take one of the exams, is that done? You can't take it again?
No, you can take it as many times
Oh,
as
you
you
can
like.
keep- redo them?
Yeah.
Okay.
Yeah, you can take it as
Talking
many
about
times
the
as you
free
like.
ones?
Yes. I'll send the free ones.
I wouldn't start doing
But I
them
see,
now.
even for me, it says some of them are $10 a piece. Even for me as a member. But not the 6. They give you 6.
Yes, they give you 6.
But you could do more.
You can do more.
Yeah.
Yeah, pay for them. 6 should be enough, especially with, I wouldn't start doing them now, guys. Because you just panic. And I really don't want you to do that. So, but yeah, towards the end, if you follow your, the roadmap, if you follow the roadmap, that works very well. And that would be 6 months from graduation, then you graduate at the beginning of May. So, November, December, start doing it. That's
you
beginning of
recommend-
May, so October, November, December, January, February, March, April.
Do you recommend taking it ASAP, but the exam after you graduated, or
Yes, what?
as soon as possible,
What?
after you graduate? Do you recommend?
Oh, the registry?
Or taking more time to study afterwards? What do you think, or does it depend on the person?
It depends on the person, but I would recommend that you do it as soon as possible. And my reasoning behind that is that everything's fresh in your brain. Now, it takes a little while to get all the stuff organized with the ARRT. So you're not going to be, if you graduate, I can't remember whether it's 5th or 6th of May that you graduate. And remember, you have to graduate first before you can sit. We will be allowing you to apply to sit. I think they may have changed the rules, but it used to be 3 months in advance. You can actually apply to the ARRT to sit. But because your graduation date will be the beginning of May, they will not give you the final okay until you actually finish that graduation date. But, and then you apply, and they'll give you basically what amounts to an examination number. Then you apply to, it's called Perkins View, which is an examination center. And that's where you sit your exam. So on the computer, but you have to be prepared. So if you're one of these people that really think that they need preparation, lots of preparation, then maybe wait a couple of months. I wouldn't suggest you wait more than about 6 months, because everything goes. But yeah, as soon as possible, put it that way.
So if we wait for like graduation to apply to sit the boards, how long typically do they have like a date for you?
If you wait until you graduate to apply, it's probably gonna take the ARRT maybe 6 weeks to get it organized. Now, they've changed the rules a little bit. It used to be that you had to do the registration on paper and then mail it in. I believe now you can do it online, but I have to check on that and see how we go about doing that. Because up until now, everybody I've worked with and taught has had to do it on paper. So they've just newly started doing it online. I don't know how they'll go about. I guess you'll be filling it in and sending it to me, and then I sign it or something. I don't know how it will work. So I'm gonna have to look into that. But don't worry, we'll get it organized by the time you graduate. But yeah, I would say do it as soon as possible, because everything goes. All your, I won't say your brain seizes up and it leaks out your ears, but you know, you have to be aware of the fact that you want to retain the information. The other thing I would suggest you do over the next couple of days is remember that quiz that I gave you on basic radiation terms, radiation therapy terms. I would look at that again, because last time we did it, there's still problems with retaining the stuff. Okay, look at this, look at it on the PowerPoint and go through it yourselves. Because that's the kind of information that they'll expect you to know, even if you haven't been in clinic.
Which was that? Was it online? It was the blue house.
It's a PowerPoint that I sent you, and it's called Basic Radiation Therapy Terms. Things like collimator, gantry.
Yeah, we also went over it in class, March 24th. I had it written down.
Okay.
Well, I mean,
March what?
24th,
That's what it is.
This March or last March?
this one.
hadn't started last March, dear. You hadn't started last March.
So you're saying from when we first started?
The email's from March 25th.
Yeah,
Yeah, we did then, and then before that, it was
Did it
like
come?
October.
yeah, I don't know.
Oh.
That's what I wanted to do. You see, October, and you think, oh my goodness, I don't know anything, which is fine. I didn't expect you to know anything. But for the March one, you should have known a little more. So please look at them before you went to clinic. Or the first couple of days of clinic, look at them. Because they'll want you to know what the bed is, where the gantry is, where the collimator is. What do I mean by parallel opposed pair? What do I mean by parallel opposed pair? APPA or laterals. Anything that's 180 degrees about. You could even have a parallel opposed pair obliquely. Right? Things like IGRT, IMRT, things like that are now commonplace terms. Everybody does IGRT now, everybody does IMRT now. So we want to make sure that you know your terms. I was just telling, that's okay. I was just telling your colleagues here that on March 24th or 25th, remember the quiz that I gave you on radiation therapy terms? PowerPoint that I gave you.
Uh-huh.
Look at it
Okay.
within the first couple of days of treatment of clinical. Make sure that you know at least some of these terms, because people are going to ask you. And you don't want to say, oh, I don't know. And then they'll come back to me and say, well, I know they know these terms. Yes, they do. You just forgotten.
I get nervous when I ask questions.
So what did Tony show you at the clinic? What did he show you? Or he and his staff, what did he show you?
They started us off in simulation CT, showing us the bolus machine, mats, and the little BB pellets. And
Right.
to use. And the devices, mobilization devices, and then they moved us into.
So what immobilization devices did they show you apart from the masks?
Back box.
The back box, okay. And now,
I think they showed us the weak board, didn't they?
yeah, that's not actually an immobilization device, but yeah, okay.
Okay.
The whiteboard, did they show you a breastboard?
Yes.
They did,
She went to the treatment room to show us that.
Yeah. okay. So what did they show you in the treatment room then?
A whole bunch of different electron applications.
Uh-huh.
We had an Alexa there, so we
Yes, that's
showed us the back side of
Mm-hmm.
the machine.
Huge.
They showed us the electron cones, the different sizes.
Right,
The 20 million computers on the outside.
yeah,
They showed us the progression of the tumor volume shrinking throughout treatment of different patients.
Yeah.
They showed us a couple.
What were the cutouts called?
They showed us the metal cutouts that were, they were treating somebody's leg on their calf. So as the tumor got smaller, they had smaller and smaller size.
Oh, the surgery?
they're electron cutters, is what they're called.
Electron cutout.
Mm-hmm. What else?
They showed us a 3D printed bolus, which is pretty cool.
Yeah,
Right.
okay, yeah. What else? Anything else?
They showed us the console and all the different.
I do remember, but I didn't think so. I just don't know.
She showed us like, I don't know how to technically say this, But like the images from the treatment room overlap with the CT images
Yeah.
to show the different colors and how they're supposed to line up and stuff. She
Yeah.
showed us that was cool.
That's just IGRT. Yeah. So you got the DRRs, which are what?
Digital.
That's a new quiz. DRR,
Digitally reconstructed radiographs.
and where do they come from?
Not the orthogonal pairs? Or
Not necessarily, no. Where did they get their DRRs from? Who manufactures them? Where did DRRs come from? They come from the symmetry. And they're from the CT scan. So they basically take, it's like taking a still photograph from a movie. So it's a DRR, it's an X-ray that is taken from the CT. And it shows, so what does a DRR show?
The volume of the tumor, the shape of it, location.
The shape of the tumor, well, the DRR is only an X-ray, right, or an image.
So just one slice, one dimension.
One dimension, well, actually two dimensions, because there is no such thing as one dimension.
Alright.
2 dimensions, well, I guess there is, but that's Star Trek. We really won't get into that. So, 2 dimensions, 2-dimensional flat X-ray or image. It shows the area that we're treating with the MLC. That's what DRR shows. And it can either be an EP, a lateral, a PA, or an oblique. It doesn't really matter. You can have a DRR for anything. So what do we use them for again?
To help plan the treatment plan,
Sorry?
to help set up for the treatment plan.
Yes and no. The DRR is there to give a reference image, to use as a reference image against the portal image that you take on the machine. Why do we take portal images?
Check for any shapes or changes.
Okay, you have to make sure that you're still treating in the right area. So you have the portal image on the computer, and you have the DRR image on the computer, and you superimpose one on the other.
That's the word. Superimpose, that's what she said.
Yeah.
I could not
So we
remember that.
superimpose one on the other, move them around so everything looks good, and you know then you're in the right place. And with the high-tech gear that we have these days, all you have to do is hit a couple of buttons and the machine will move itself into, or the bed will move itself into the correct position. But you have to remember that you have to tell the patient that the machine's going to move. Otherwise, you'll have a panicked patient in your bed. Anything else? What else did they show you? So we showed you the superimposing of the DRRs and the images. What else did they show you? Obviously, the patients have gone by then, so you had nobody to see. Did they show you the symmetry? No, he didn't show you the
We
symmetry.
did, they had one more patient they were like having to wait for bladder to fill up and stuff.
Oh, I
so
see.
We were kind of just like picking what we could get.
That's fine, that's okay, yeah, okay. So what else did they show you? That was what all?
Pretty much.
The CT sim room, and then she took us to the treatment room, big huge door, soft machine.
She moved stuff around, watched the machine move.
Yeah. So did you find that the amount of work that we did upstairs helped. You actually could see that it's actually the same hand control.
Yeah, I was like, I know what those buttons do.
Well, now you know. Now you know why we spent that amount of time going over, especially the Electa. Now you can see, and you have a copy of the cheat sheet. So, although the real life hand control might be slightly different than the one we've been using, but it still gives you the same idea.
Do you happen to know, remember which locations have which machines?
To be honest, don't know.
A lot, I figured. I was just curious.
I know that obviously, let's see, the Proton Center has both Varian and Electa, and I think the Varian is a true beam. I'm not sure whether they'll let you on that because there's 2 Electas and 1 true beam, so depending on what they're doing.
I saw an Electa in a picture for the Gainesville UF location, but
So
I think
they have 6 machines, but
Yeah.
one's not working.
and
So there's only
they're
5.
replacing one of them, so, I think they have both, if I remember correctly. Where else are we? Sanford, I believe, is a variant. MP Anderson, I believe, have true beams, but don't quote me on that. South Georgia, I can't remember what they have, to be honest. And Orange Park, the last time I was there, had a variant, but I'm not sure whether they've got rid of that one and got a new one or not, I have no idea.
I tried to look it up, and you know, when I looked at like what machines they used, it just said linear accelerator. I was
Yeah.
like, okay, well,
Yeah, it's
At least
not
we know that.
interesting, yeah.
yeah, I had to stalk Facebook pages to see the Electa for you.
it didn't say variant or left or.
No, they usually don't, but, I think it was, if I remember correctly, I think it was a variant at Orange Park, so I could be wrong. Because it is not even last year, year before last, was the last time I was there, so, before the pandemic hit, so. But I think you'll enjoy it, guys, I really think you'll enjoy it. You really will. Once everybody gets into the habit. I will be, this is my official semester off. So I will be in and out of the department, but I will be available on email and cell phone if you need me. I will be here in the morning tomorrow. So let me know if things go haywire.
I'll call you Brian.
Sorry?
So I'll call you Brian.
Just don't throw up on me, okay?
Better you than them.
Oh, I don't know about that. Wear scrubs, remember? Oh, and yeah, please remember and wear scrubs, okay?
Yeah.
You feel like when you're a kid. Like I feel like if I call you, I'll be like, Mom, I can't do this.
At least you know where it is.
Yeah, I guess so.
Yeah.
I'm so
Yeah.
nervous.
Same. I went Friday.
Pardon?
I went to Gainesville Friday.
Okay.
I know where it is. I'm just saying.
So who got down, who missed it?
Oh, I missed it. I mean, the
Did what?
the thing at the,
The chair.
I didn't get that.
That's okay, don't worry about it. As I say, it's not mandatory, because,
It'd have been nice though, I think.
pardon?
It was probably very helpful.
It was such a nice place, but gosh, it was such a drive.
They kept it nice and AC,
Yeah.
big room.
I was like, I wanna go here, but I also don't wanna drive here.
So, you'll notice it was kind of chilly in the department, and you know why? Yeah. It's actually machines the cool.
Not fun.
So,
I imagine if you're moving around and have patients every 15 minutes, you probably stay pretty warm yourself.
and that's basically why I've never worn long sleeves, because I get too hot if I'm running around,
to wear
and
long
you do run around quite considerably. And as you say, every 15 minutes you have a patient. It can get rather busy. And that's why I'd suggest that you do not, or you choose your times to ask questions.
That
Not
was
when
my
they're,
worry, was if I have a question and I don't get a chance to write down the whole thing right away and they're bringing somebody else back, I'm afraid to forget my question.
then that's why I suggest you use a little pocket notebook. Get a pocket
I've got a
notebook
couple.
and just put it in your pocket, and then write it down if you have questions. And it's also helpful if they're telling you something that you think you might need in the future, write it down. Because you're never gonna remember all this stuff. Write it down. And it's better than carrying something like this around with you. You don't wanna do that, so a nice little notepad that fits in your pocket. What else is I gonna say, remind you of? No cell phones, ladies and gentlemen. Keep them in the car, keep them in the locker, keep them somewhere, but do not have them on the clinical site, at the clinical machine. If you have to give somebody a number to reach you in an emergency, give them the general number. That's the number usually of the receptionists. Or you can get them to text you or call you and leave a message. If it's something you need to do urgently, then get a number of the receptionist and tell them that you may have an emergency call coming through. And let them know who you are, because they may not remember who you are. Because you're a student, right? There's lots of students wandering in and out. Medical students, nursing students, depending on who you are, where you are. Anything else? Anything else that you want to ask me about clinical site, about clinical, not so much the sites, but the clinical itself? Remember your timesheets. That's the most important thing to begin with. Your timesheets.
Do we need to go in on day one, bringing that in to them?
Yeah, just whoever you are paired with, in whatever machine you're paired with, say, this is my timesheet, and it needs to be filled in by you, and then by yourself, and initialed by whichever therapist is working with you. If there's 2 people working with you or 3 people working with you, it doesn't matter. Whoever has got time to initial it at the end of the day. And I need them all back in, those of you who start this week, on Monday. I need a copy of them, or I need the original. You keep a copy. Remember, everything that you give me, you have to have a copy. Does that make sense? So have a copy of your own. don't give me the only copy. You need a copy of your own. Anything else? Close for the slow. Let me just go on to the SART website.
Yeah, that's a good break. I was thinking of going to the gas station. Maybe.
So this is the ASRT website. Oh, shoot, sorry, hang on. What's coming up? I don't know why that always comes up. Go away. Go away. So, okay. So this is my dashboard. So here's my renewal period. So my birthday's in December, as I mentioned. So I have from the beginning of October to the end of December to renew my registration. And here's my biennial that I mentioned. Total credits required, 24. And complete CE activities between 12/1/2019 and 11/30/2021. So I have to get all of my 24 credits in by the end of November because my birthday's in December. And I have to report these continuing education credits by the end of December this year.
How many have you done?
Pardon?
How many have you done?
Oh, I don't know, 10 or 11, I think, for this year. So let's see, so we have so this is about the ARRT. And let's see, conferences. So verify, if I wanted to find out if somebody has a credential. An A is an RTT credential. If I was an employer and somebody comes into me and says, yeah, I graduated, I did the registry and I have an RTT, then I could go online and put name in there and find out whether somebody is actually registered with the ASRT, for the ARRT.
The letterhead, something you would want to print up and submit with, like, when you're applying for a job, is that the point of that?
No. What you do when you apply for a job is when you graduate or when you do the registry, you get a certificate. The registry exam, that's what you send to the ASRT, to the job site. They don't care about letterhead, they want your examination certificate to say that you've passed the registry exam. It doesn't tell you how much by. All it says is that you have a registry examination certificate. I have one in my office on the wall. And it tells you when you did your registry. And, but nobody is gonna ask you, some people keep asking me this, nobody's gonna ask you, how much did you get in your examinations? Nobody cares. As long as you have that registry certificate, nobody cares. The one thing that they may do is some departments will ask you for a copy of that and they'll put them up on the wall so the patients can see them. And also the license. You need a copy of your license to put on the wall so the patients can see that everybody's licensed. And the state can come in, and if they don't see your license and especially your license, they can actually send you home if there's no license up on the wall for you. And they can fine the department because it is, you have to be registered with the ARRT and you have to be licensed by the state of Florida in order to work. And in most other states as well. So if you go to California, you need a California license. If you go to Georgia, you need a Georgia license to work. If you go to Texas, New Mexico, anywhere, you need a license. And usually, I don't think there's anyone now that continues. It used to be in California, you need to do a test, but now they've stopped that, so you pay your money and you get your license, as long as you have a registry. Makes sense? And there's the number of the ARRT, and you'll get that when you get your registration. There's contact numbers. So applications, continuing medical and renewal, continuing experience. curriculum development, taking the exam, and we'll go through that later. And then estate licensing. And the address and phone numbers are all there. Sanction list, this is an interesting one. So this is all of the people who have been sanctioned. It doesn't tell you why they've been sanctioned. Yeah. There's almost 2,000 people on that list.
So that's for the nation.
That's for the nation. And it's in alphabetical order.
I see. Amazing job.
Let's just try it again.
Dang it, Steven.
Come on.
Already? You haven't even started yet.
I was 12.
So there, now, this doesn't mean, this could be X-ray, radiation therapy, nuke med. It could be either of them.
He was 12 in 2010.
2021.
God, Steven.
So it has been, probably what happened was they were suspended while an interview or they were looking into it.
1979.
Got revoked.
Could these be people who just let their registration lapse because they stopped working and just never updated stuff? Can you be revoked for not?
No, revoked means
Oh,
that
that's
you've
disciplinary.
You've lost their
They took
the registration. It means you've done something really.
Yeah, it says disciplinary sanctioned, so.
It's interesting sometimes I look through them and think, oh, okay, thank God I don't know anything.
I wish they say why. You can look up all the people who are being court-martialed and like what they did and everything. And so sometimes I like to do that for fun.
Yeah,
There's a lot of child rapists in the military. Just saying.
The 2019 was the one I came out. I suppose that's good for employers.
let's see, yes, exactly. So here it is, reprimand, form of discipline declares that specific conduct was improper. It doesn't limit the person's right to use the ARRT credential. Suspension or summary suspension, that's the one that we saw. Person's certification and registration is immediately suspended. We typically use this sanction in situations where there's potential of harm to patients or the public. This person cannot use the ARRT credential, designation, mark, or name in any manner or purpose during the suspension. Summary suspension can lead to additional sanctions up to and including revocation of certification and registration. So revocation means that certification and registration has been removed. It's the most serious ethics sanction imposed. This person is prohibited from using an ARRT credential, designation, mark, or name in any manner for any purpose for a specific period of time. So it doesn't actually, if they're revoked, they may be revoked forever. If not, they may have a little bit. So that's basically what that is. So 5.
there's the handbook, and I will be giving that to you later on. And I believe now they have, it all electronic there. So I believe you can do this without actually logging in. I believe that you can actually record this. But I will be showing you all this later. It's too early to start worrying about it now. So any other questions? If not, I'll let you go over it.